When heart valve disease progresses to the point that treatment by medicine does not provide relief from symptoms, a physician may be recommended to repair or replace the valve. If the heart valve cannot be repaired, a decision must be made as to what type of replacement valve should be used. Typically, the choice is between a carbon-based mechanical valve and a tissue valve. The physician and patient will choose the type of valve while taking into account the risks and benefits, the patient's overall condition and preference. An artificial heart valve is a man-made device used to replace a heart valve that is not working well. Tissue valves, also known as bioprosthetic valves, come from an animal tissue, which can be the actual valve from the heart of the animal, or it can be made from the tissue surrounding the heart of the animal. They are commonly sewn from pigs, which is called porcine valve, or cows, which is called bovine valve. And the pig heart tissue is more commonly used other than the cows, because the cow valve is more common to tear over time. And the heart valves usually last for 10 to 20 years. These tissues are treated and neutralized so that the body will not reject them. Some tissue valves are mounted on a frame or stent, while others are used directly, also known as stentless. Mechanical valves are made from manufactured substances with mechanically moving parts. The most common type is a bileaflet valve, which consists of two semicircular flaps that pivot on hinges, which are made from very light and long-lasting material called plyoelectric carbon, to control the blood flow in one single direction.
3 common types of heart valve diseases that often require heart valve surgery include regurgitation, stenosis, and atresia. Heart valve regurgitation and stenosis are commonly caused by calcium deposits and birth defects, whereas atresia is usually the cause of a change in the baby's genes or chromosomes, all of which lead to the heart weakening, a reduction in blood flow through the affected valve, chest pain, shortness of breath, and fatigue. Regurgitation is used as an umbrella term for leaking heart valves. This can allow blood to leak backwards as the valves are closing, or it can allow blood to squeeze past closed valves, making your heart work harder to keep the blood pumping forwards. The mitral and aortic valves are the most commonly affected by regurgitation. Heart valve stenosis is the general term used for a heart valve that is narrowed and unable to fully open due to the flaps thickening, stiffening, or fusing together. All 4 valves are capable of developing stenosis, with aortic stenosis being one of the most common valve diseases. Pulmonary atresia is a birth defect of the heart where the pulmonary valve, which controls blood flow from the heart to the lungs, doesn't open properly or at all. It is commonly diagnosed soon after birth, where blood has trouble flowing to the lungs to pick up oxygen for the body. There are ethical issues associated with tissue or valve extraction from pigs and cows. Heart valve testing in animals such as dogs is also of concern. Safety concerns for both tissue and mechanical heart valves can include lung problems, infection, or bleeding during or after the surgery. Patients who receive a manufactured valve will usually require a blood thinning medication called warfarin for the rest of their lives. Clots can form in the valve flaps or hinges and cause an embolism, in other words, a traveling clot, which may lead to a heart attack or stroke. However, the life expectancy in patients who had a mechanical heart valve compared to tissue valve is greater. On the other hand, tissue heart valves have a shorter time needed for blood thinner medication, being 3 to 6 months, although tissue valves tend to wear out after only 5 years.
The cost of an artificial heart valve can vary greatly depending on which biomaterial is used and which valve is being replaced in the heart. Over 280,000 artificial heart valve replacements are undertaken each year. It is safe to say artificial heart valves are cost-effective and readily accessible to patients. The science and interest behind biomaterials which are biocompatible is increasing, and thus bioengineers are striving towards finding a material which will not require replacement due to degradation or faults. Another key interest is finding a material which can regenerate in order to minimize risks of multiple surgeries. There is approximately the same to slightly higher number of replacement surgeries done every year than there is of first-time heart valve surgery. There is ever-growing interest not only with artificial heart valves but with the entire biomedical field. There is ongoing research into the advancements that can be made. As of yet, artificial heart valves are the most cost-effective treatment for those who suffer from heart valve diseases.